Hi, everyone. It's DocTalk. We're here after Halloween, after the elections, after really we think the hurricane season is over, and we're muddling our way into infectious disease season. And the real topic that's been in the news health wise has been pneumonia and walking pneumonia and a type of bug called mycoplasma which is causing infection in a disproportionate amount of children right now. So let's muddle our way through the discussion of pneumonia and walking pneumonia. When we get infections in our respiratory tract, they can kind of begin either upper or lower, or if you will, all the way low, which is into the tissues of the lung. Upper respiratory infections, colds, and allergies, which can be combined with colds. We can have infections in the middle section here, which is our throat, and those can be either viral or a kind of bacteria called strep, so strep throat. We can have bronchitis, which is an infection of the tubes that go down into the lungs. In some people, that causes wheezing. That is almost always caused by viruses. We can have an infection right at your voice box, which takes out your voice. That's called laryngitis, and that's essentially always viral. And then you can have infections down in your lungs and in the lung tissue and in the little sacs where actually the working part of your lung is, which is where they exchange oxygen and carbon dioxide into the blood. Infections down that far we have always called pneumonia. And pneumonia can be caused by a number of things. It can be caused by swallowing stuff into your mouth, which bypasses the protection that you have here. And food, liquid, vomit, something gets down into your lungs. And that's a really bad form of pneumonia called aspiration pneumonia. You may be more aware of that with the elderly and with people who have drowned. And so that's when you actually get liquids or combination liquids and fluids into your lungs. A second form of pneumonia comes from things like molds and fungus. Those are very bad. They oftentimes are in people who are really seriously immune compromised. And in certain areas of our country where certain kinds of molds live, and in people who aren't used to it and can't defend against it, they can get those pneumonias. The next form of pneumonia is our traditional pneumonias caused by viruses and bacteria. And those cause more profound problems with you being able to breathe because this takes out the area in your lung where actually air exchange occurs. So pneumonia is always worse than the other respiratory tract infections, the ones from here up, because pneumonia impacts your ability to get oxygen in, carbon dioxide out. The kinds of bacteria that cause pneumonia are numerous, but one of the ones that we found over the years causes a pneumonia is a bug called mycoplasma. And traditionally, it does not cause as severe an infection in the lungs as other forms of bacteria. And then it has a different appearance when we take X-ray pictures of people's lungs in the office or in the emergency department where I work. And so when we see patches of pneumonia in different places and the person is not very sick, we call it atypical pneumonia, or in the public's eye, it's called walking pneumonia. And so many of the forms of pneumonia which don't cause serious infection, and this one particular bug called mycoplasma really has a tendency to do that. Those are atypical pneumonias or commonly called walking pneumonias. Now, in certain people, walking pneumonia can still be serious, and that walking pneumonia can devolve into hospitalized pneumonia. But typically, these are not serious cases, and people get through them over a period of weeks. And that's one of the other problems with pneumonia is it takes weeks to a couple months to clear all that junk out of your lungs and get them back to where they're using all of the spaces in the lungs to do what the lungs are supposed to do. Just so I can finish that message for a second, we have viral pneumonias, which typically cause even less severe infections in the lungs are very common, and many of the forms of viral pneumonia give you coughing for long periods of time. This year, we've had more of those cases of mycoplasma pneumonia occurring in the fall season. And this year, for whatever weird reasons, they've affected young people a little bit more. So we've had them in the children and in the teenagers and spreading through the schools. So you may have heard about walking pneumonia in the schools, and it means the kids are going around coughing, 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 coughing. Even when they're much better and they're not infected anymore, they're still trying to get stuff out of their lungs, so they still cough. And this year, it really has been a 6-week cough. When you get one of those respiratory infections, it takes about 6 weeks for you to stop coughing. Leads to one other important point. When you talk to your doctor says, I'm not giving you a cough suppressant. And there's a really good reason for that. There's only one way to get infected material out of your lungs, and that is to cough it out. And the easier we make it for you to cough, the more effectively you can get stuff out of your lungs. And typically, as most of you know, you cough it out and then you swallow it. And in the acids in your stomach, it all gets eaten away and it's not a problem. Most doctors will not prescribe cough medicine because it goes against your body's defenses. And if we really gave you something that was 100% effective in reducing your cough and taking your cough away, you would all get terrible pneumonias instead, because the bad stuff that your lungs are trying to clear would stay in your lungs and they would grow and get worse. So don't force a healthcare provider to give you a cough suppressant because you're coughing, 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 coughing. Because this year that cough is lasting a long time. That's kind of typical of viral pneumonias and this bacteria called mycoplasma. And what it is irritating is when you can't cough, when you can't sleep at night because you're coughing. And oftentimes changing positions and laying down, stuff moves around in your lungs when you change your position, and that makes you cough a little bit more when you get to bed. So the essence of this is, before you try to go to bed, breathe humidified air that helps you loosen up your cough, puts moisture down into your lungs, and allows you to cough before you try to go to bed. It's always good if you're going to have a coughing spell or your child's going to have a coughing spell, to have them do it before they try to lay down and go to bed. If they're coughing anything out, they can either cough it out into a Kleenex or the sink, or they can swallow it. It really doesn't matter. And swallowing your cough will not hurt you in any way. I want to make that very clear. In little children, we oftentimes will put a mister, a cool mister, in their room, and in that way add more moisture to the air. Just so you know, adults don't do very well with that because the mister can't put enough humidity into the air to help adults. Adults get helped by hot showers that they're in for 15 or 30 minutes, or steaming the bathroom somehow and staying in there for 15 or 30 minutes, or going and sitting in the hot tub and breathing the steam off of that for 15 to 30 minutes. And you're hoping when you're sitting in there, it's loosening you up and you're coughing a little bit. And frankly, you want to be a little productive and getting stuff out. And that's the protection of your lungs at work effectively. At night, you can take a little something that helps you sleep, and there's nothing wrong with that. But again, all night long, your lungs are trying to protect themselves, and it can happen that you cough during that time. So that is a quick little thing about the current bugs that are going around. Why they're affecting children a little bit more now, we don't know, but that's what's happening. This is not a life threat. We do not have a vaccine for it. Mycoplasma can be treated with a short course of antibiotics. The antibiotics reduce the infection. They don't make the cough go away. And if you get one of these respiratory infections this season, just be aware 6 to 8 weeks of coughing is not atypical. Still a great time. As a matter of fact, probably the best time right now to get your COVID and your flu vaccines before we are heading in the season. We've noticed locally our flu curve beginning to creep up a little bit. It's flu A, the same flu that they have been having, the same type of flu A that they have been having in the Southern Hemisphere. protection from that in the flu vaccine. And for those of you over the age of 60 or with immune compromise issues, get your RSV immunization. And for children under the age of 2, either mom while she's pregnant gets the particular kind of immunization, or the babies get a monoclonal antibody in their first 2 years of life to protect them from RSV. We are clearly into RSV season, and you can hear that every day when I'm around the emergency department, because the crouping kids are there, and that's an RSV infection. So there we are, moving into November. Most of the country is still very warm. We saw our first snows up in the upper plains. You know that cold bug is going to come at some point. And again, for those of us who live in the Gulf Coast area, seeing an end to the hurricane season is a really good one. So stay healthy, protect yourself from the cough when you can, stay away from people who are sick early on in their disease. Later on, loose cough, it's not infectious to you, don't worry about it. Take care of yourself. DocTalk, beginning in November. Everyone take care. Thanks. Bye.